We also have to do it on health care. It is long past time here, too. I bet there are some doctors and some nurses and some health care workers here in the audience. And I appreciate having the endorsement of the American Nurses Association, because they know, as I do, that if we don't have a system where everybody has health insurance, we're going to continue to have a deterioration in health care for everybody. So here's what I think. If you have health insurance and you like it, you keep it, no questions asked. But if you're uninsured or you have insurance but it doesn't pay for what you need, we're going to give you some new health care options, because we have two choices, either to continue what we're doing or to change. And we cannot continue what we're doing. And so for me as a senator, I spent a lot of my time trying to help people who have insurance get the insurance companies to pay the bills. Have any of you ever argued with an insurance company to pay the doctor or the hospital? I'll tell you, I'll never forget the day, a couple years ago, a man called me from northern New York, way up by the Canadian border. And he said, "Senator, what have I done wrong? I've worked for the same employer. I've always paid my premiums. My family's never needed any real health care. We've been healthy. My son has just been diagnosed with a rare disease. The doctor says there's only one place that knows how to take care of it." He said, "I didn't think anything of it. I called the insurance company. I've had them for years. I told them what we had to do, and they said no. They wouldn't pay for it. It was a $400,000 operation, and they wouldn't give me the insurance for it." So, I argued with the insurance company, and my staff argued. And eventually, I think the insurance company was afraid we'd embarrass them, which we would have done. So they agreed to pay for the operation. It should not take a United States senator to get a father the health insurance that he had paid for out of his pocket for all those years. So we're going to open up the plan that Congress has for itself and for federal employees. This is not government-run medicine. This is not a new bureaucracy. This is what Congress and 9 million federal employees already have. And I figure if it's good enough for Congress, it's good enough for the people of North Carolina and America.